Hello my dearest students, this is Dr. Rohit Daniel, your Orthopedics Faculty from DocTutorials. So, I know that many of my dear FMGE students are a little bit scared because there are a little over 50 days for the upcoming FMGE exam, right? So, I know that many of you are little apprehensive, that is obviously going to happen. Anyway, my idea with this talk is to guide you through what you should do so that in the next 50 days you can maximize the time and utilize the time to the best so that you can all pass with flying colors. Okay, so that is the whole idea. So that is the whole idea of this session. So this is a live chat that is going on in the YouTube. So if you have any doubts or anything like that, you are welcome to ask in the comments box. Okay. Hello Rakesh, welcome to the discussion. So this I wanted to be an interactive session. I will be giving you some important pointers, but if you have any doubts or any personal concerns, you are welcome to ask me. Okay. So whenever I am interacting with my students, I find that you can broadly classify the students into 3 groups. Okay. So you look at the 3 groups and you tell me which group you lie in. Okay. So in the first group, we have the really smart students who have already finished reading the subjects at least 90%, and now they are really worried how to move forward. They have around 50 days left. They need guidance as to how to go about their revisions, which topics to prioritize and all. So these are the first group of students. Then in the second group, we have those students who have already completed the subjects or they are not sure how to revise. Okay. Now, in the second group, we have another set of students who have already in the prior exams already given the exam, but their score has been between 140 and 150. In the third group, we have a group of students who may not have fully completed their studies and they have not finished their subject as of now, or these are repeaters who have scored less than 140 in their prior exams. Okay. So, hi Ravinder, hi user. Yes. So these are the broad 3 classification of students from what I understand. Okay. So let me start with the group 1. Okay. So tell me, how many of you students feel that they are in group 1? So have you finished all the subjects and are you going on with the revisions according to your plan? Hi Deepika, hi SK. Yes, SK is saying that he comes in group 2, isn't it? He is in group 2 because previous 2 times he has attempted the exam and his score is 141 and 143. Deepika has scored 147. So again you come in group 2. So I will discuss the strategy for each of these groups. Okay. So listen to me. So is there anyone who is in category 1? Medical knowledge 5668. Great. So you are in category 1. So you have already finished the subjects and you have already started with the revisions and you need a little bit of guidance. So I will give you that. Vishnu Sanjeev has not yet started. So you are my favorite kind of students. You are in group 3. Don't worry, I will guide you what you should do also. Okay. So Prince again in group 3. Don't worry. We have a strategy for all of you guys. Okay. So what should group 1 students do? So a lot of students are saying they are in group 3. Okay. Don't worry. We'll solve all your problems. Yes, Ravinder was in group 2 because when he attempted, he got 147. That is a good score. Okay. So what should group 1 students do? See, things are going well for you. So what you should do is that you should stick to your plan. Okay. So don't do anything fancy. You are doing good. Stick to your plan. Okay, that is all that is needed. You are going to pass with excellent marks. You don't have to listen to me because you have already you already have a plan. Just you focus and you comply with the plan. That is all. Don't get distracted at the last moment. Sometimes what can happen is that students will feel that I have already finished my subjects, so let me relax for 10 days. Never do that. Okay, if you start relaxing for a few days, you will completely get dislodged from this track, and once you get dislodged from the track, then it is very difficult for your studies to come back on track. Okay, so never do that. Stick to your plan. Every day revise. Okay, revise according to your plan. This is very, very important. And keep the self confidence high. Many brilliant students, what I feel is that they study very hard, they do the MCQs, they do everything, but at the time of the exam they have this fear, oh my god, last time I did not score this much, this time I have studied, but I fear that this time also it is going to happen like this. My father, my mother have invested so much money, even though they have financial difficulty, they have invested so much money in me, am I going to fail them? So don't think about all these things. Okay, take all these negative thoughts out of your mind and keep it aside. Okay, keep self confidence, this is important, and keep doing MCQs and grant tests. So this is very, very important. Okay, so don't take MCQs lightly. You may know the subject, but unless you do MCQs, you keep on doing MCQs, otherwise you will not develop that skill. So remember, doing MCQs by itself is a skill. Okay, so just because you know a particular theory of a particular subject, it is not necessary that you will be able to do the MCQs. Okay, so keep doing MCQs and keep doing GTs, grant tests, because in grant test there is a strict timeline that you have to follow. So it will be like the exam itself. So there will be time pressure. So you will be accustomed to how the exam is going to be. Okay. So I have received few more comments. Let me just see. Yes, Ragesh has finished all major subjects, need to revise a few minor ones. You are in group 1. Okay, minor subjects is okay, you are in group 1. Keep up your plan. Okay, you don't have to listen to me, you can switch off the video if you want, no problem at all. Okay, so you keep up what you follow, you don't have to listen to anyone else. Only thing is that don't take things lightly, keep on doing MCQs. Okay, so that is what people in group 1 should do. Okay, now there are so many students who are messaging me saying that they are in group 2. So you have completed the subject but not sure how to revise, and many of you are repeaters who have actually scored between 140 and 150. I have seen so many hundreds of students in this category. That is so sad, because they have put in all the effort, but at the final lap of this journey you are faltering. So this should not happen. Okay, so what is going wrong? See, all my dear group 2 students, that is those students who have finished their subjects but are not sure how to revise, and those students who are scoring between 140 and 150 previous times. So listen to me, you have good knowledge in theory and subject knowledge, so you have good knowledge, but what is your weakness? You are not doing enough MCQ based preparation. That could be one reason. Maybe you are not doing enough GTs, grant tests. Maybe you are making silly mistakes. Maybe you lack self confidence, or some students I know, they panic in the exam hall. I have seen so many students who in our DocTutorial GT score consistently about 200, and we think that they are definitely going to end up with 220 or 230 for their exam. Finally, when their marks come, we are all shocked because they end up with 135, 130 and all. We all would be in shock. The main reason for this is that they panic in the exam hall. Okay, so this is not something you should take lightly. This usually happens when when the first block of questions are difficult. So let's say the first 20-30 questions are difficult, then the panic sets in. You think that, oh my god, this exam is gone. 30 questions I have lost, I have no idea. The rest of the questions are also going to be difficult, I am going to fail this time also. And when that thought comes in, you make a mess of the exam. Maybe, usually what happens is that the first 30 questions would be difficult. That is for testing you. Okay, the examiner wants to test you. The first 30 questions will be difficult. The next, if the 30 questions are difficult, I am sure that the next 200 questions are going to be easy. Okay. See, the only mark you need is 150. 30 questions can be difficult. 100 questions can be difficult, no problem, you leave 100 questions. If you don't know, don't leave, I am just saying it like that, you attempt all the questions, but even if you are not able to attempt correctly 100 questions, no problem, you have another 200 questions, isn't it? So don't get scared or panicked when you find that the initial 20-30 questions are difficult, okay. So this is very, very important. So Ravinder is asking how to minimize these silly mistakes. Practice, keep practicing, okay. When you keep on practicing, it will come. I will make sure that, okay. So what are the things the group 2 students, so many of my students, okay, so many of these the students that are listening to me are in group 2. So this is what you have to do, okay. Focus on your revision, and how you have to do that I will come in a little bit. Keep practicing MCQs that I said. How and how many I will tell you later. Do weekly grant tests, and this is important. Note down mistakes and work on them. The most silly mistake while preparation that I see from students is that they do 100 questions MCQs in a day, and they say that okay, 60 questions I got right, so I have done very well, 60 questions I have got right, 60% is correct, 40% are wrong. No, not to worry, tomorrow I will attempt another 100 questions. No, that is not how you have to do. If you have 40 wrong answers, 60 correct, 40 wrong answers, 60 correct answers have no value. For your preparation, what is valuable? 40 wrong answers, okay. That is what you have to concentrate on. You take a notebook and you see what all mistakes you made and write down the important points there itself, okay. So if you have made any mistake, let's say in a topic called osteoporosis in orthopedics, so you take down the mistake that you have done and make sure that you never make that mistake again, okay. So always go back to your MCQs and GTs and note down your mistakes and work on them. So this is a very, very important point. So SK is asking if 50 days are enough for those who are stuck between 141 and 150. More than enough, okay. More for group 2 guys, 50 days is too much time, I would say. You have lot of time to pass this exam, okay. Don't worry at all. So this is important. So many students are asking me how to prioritize. So there is little time and lot to study, no. So prioritize, okay. So you have to prioritize your time. So what you do is that you focus on the 4 golden subjects or the most important subjects. We all know what they are: medicine, surgery, OBG and PSM. And we get more than 100 questions, 120 questions from these 4 subjects. If you add pathology to it, you can get another 20 questions or so. So pathology is a sleeper subject because you may not get too many direct questions from it, but you get questions from pathology with combination with surgery or medicine or something like that, okay. So focus on the golden subjects: medicine, surgery, OBG, PSM, and if you have time, pathology. Once you have finished that, you come to pharmacology, microbiology, anatomy, physiology, pediatrics, ENT and ophthalm. And once you have finished this, you come to the 5 short subjects where orthopedics, skin, anesthesia, radiology, radiotherapy and all those, and forensic medicine, all these come at the end, okay. So focus on the most important subjects, spend more time on the important subjects then less time on the less important subjects. If you had, let's say, 200 days, I would never tell you to do like this. I would tell you to learn everything with the same amount of your time. But now we have to prioritize, okay. We only have 50 days, isn't it? Only 50 days, so we have to prioritize. Concentrate on the important subjects first, then you come to the minor subjects, alright. So life of Suhaib is asking what should he do. So this is what you have to do, Suhaib. So whatever I am specifically mentioning here, you are a student who belongs to group 2 because you are scoring 147 and 149. You just have to do a little bit extra. So watch the video if you have just joined. So you are in group 2. So these are the things you have to do. First, focus on MCQs. While you are doing MCQs and revisions, focus on the major subjects first, then come to the less important subjects. Now this is a brief timeline that I have devised. You don't have to completely follow this, okay? Everyone is different. I am different. All of you, my dear students listening to me, are different. There are no two students who are similar. So your plan is better than my plan, okay? I am firm believer that your plan is better than my plan. This is just a rough guide. So what I would say is that for the first 25 days you focus on the major subjects. In the next 15 days you focus on the minor subjects. Last 10 days you keep it aside for a quick read, so that you would be able to read some volatile subjects such as biochemistry. There would be some cycles and all. For some microbiology, some important definitions or type the various microscopic features and all those you might forget. So all those things you can quickly read in the last 10 days. Okay. Now what is your MCQ strategy? So worthy doc, don't worry, I will be telling you regarding DGTs, okay. So what should be the MCQ strategy? So this is for everyone. You must do at least 100 MCQs a day, at least 100 MCQs a day, okay. And this should be done in a time constrained manner. You can give up to 2 hours for 100 MCQs. You can either do 100 MCQs together at a particular time, or what you can do is that you can split into 50 and 50, 50 in the morning and 50 in the evening. So whenever you get time, you split it up or do it as a single block, okay. But while you are doing MCQs, what you can do is that you can, if you have the GT app, you can use it. Otherwise, what you can do is that you can also go through the previous year questions of the last 10 papers. This is important. Last 10 FMGE papers, you have to quickly go through the MCQs, because you get lot of repeated questions. For example, in orthopedics, there is something called GCT, giant cell tumor X-ray finding, has been asked 3-4 times in the last 3-4 years, okay. Then rickets has been asked so many times. Similarly, there will be other questions that would be frequently repeated in other subjects as well. So please go through the previous 10 question papers of FMGE, and also you have to go through the PYQs of last 3 INICT and NEET PG, okay, and NEET PG. So if you have time, please go through this also, because lately we are seeing that many questions are overlapping between the FMGE and NEET paper. For example, in orthopedics, we had a question on osteoporosis, something called FRAC score. FRAC score is in osteoporosis. A very similar question on FRAC score was asked in the recent FMGE as well as in the recent NEET exam, okay. So these kind of overlaps are now becoming very common. So you can just quickly go through the last 3 INICT and NEET PG papers. You can get, I am sure that you will definitely get repeats from there as well, okay. So Deepika, so whatever I am telling you is for you, okay, because you are in group 2. If you do what I am saying, I am sure, I guarantee you that you are going to pass this exam, okay. So Deepika is again saying that her weakness is in pathopharmaca and medicine. So if you have weaker subjects, you can actually prioritize them. That is why I told you the timeline I told you is not a rigid timeline, okay. It is not a rigid timeline. Everyone is different, every student is different. So however you want to structure your days, you can do that. You can make your own timetable. So what I gave you is a brief guideline, that is all. However you want, you can structure your timeline, but just making a timetable is not enough. You have to follow your own timetable, okay. That is why that is important. Now, so someone was asking regarding grant test strategy. So what should you do? So what I would advise is that you should do 1 GT per week till January 1st week. So you can do at least 6 or 7 GTs, and I would suggest that you don't do a GT close to your exam. Maybe before January 5th you complete your GTs, okay. After January 5th don't do it, because if you do a GT, let's say 3 days before the exam, and you end up with 130 marks, maybe the GT was very tough and you will get scared. you will feel that, oh my god, there are just 3 days before the exam and this is the kind of mark I get, it's better I don't do the exam. Okay, so don't do the GT 10 or 12 days, I mean 2 or 3 days before the exam. You make sure you finish up the GTs at least 10 days prior to your exam. Okay, before 5th of January you finish your GTs. Okay, now the one important point is that don't just use GT for calculating your mark. You do a GT, I scored 155 marks, very good, I did well, I am going to pass my exam. No, that is not the use for GTA. Okay, it is going to prepare you for your exam, that is correct. It is mimicking the exam, so you will get experience, but that is not it. The idea of GT is to identify your weak areas. Okay, so you look at which all mistakes you did, and just like as I said for MCQs, you identify your weak areas and you analyze your mistakes and correct them. Okay, so I would suggest that every Sunday you give a grand test, and after you do the GT, you analyze your mistakes for at least 2 hours, or if you have time 3 hours, 2 hours at least, and you see which all areas you have made mistake, and make sure that you correct those mistakes and never make that mistake again. Okay, and you have to target 150 correct answers over a period of time. I am sure that none of you will get, just 1 second, sorry. Okay, I am sorry. So I am sure that none of you are going to get 150 in the first GTO attempt. Maybe you are going to get 120. Don't worry, you keep practicing. The next exam or next GT, I am 100% sure that you are going to get 130. The next GT, I am sure that you will get 140, and over a period of time it will go to 160, 165, and towards the end make sure that if possible you maintain it above 150. So if you get one GT a little lower mark, don't worry, maybe the GT was really tough, don't worry about those things. Okay, but make sure you give the GTs regularly and correct the errors you make. Okay, alright. So I will just briefly tell you regarding the revision booster plan that is brought about by DocTutorials. This is specifically designed for students in group 2 and group 3. Group 1 students don't have to take this because it is not much useful for you. This is for students in group 2. This booster pack is mainly to aid you in doing GTs, grand test, and there are specifically designed MCQs, and there are also the quick revision programs, and also face-to-face classes are available for revision. Okay, so if you find it that you cannot study on your own in the next 50 days, we are here to help you. If you find it difficult, you can always subscribe to this. Okay, now this is important. What are the things you should not do? Okay, so one thing, do not start a new content. There is no point in starting to study new things or new textbook. You focus on what you have already studied and you try to revise those things. Do not follow multiple resources. Focus on a single resource because you don't have time for changes. Then do not skip your GT analysis. This is very, very important. Analyze your GTs and mistakes and correct them and make sure you never make them again. And do not panic if there are fluctuating scores. Okay, this is what I said earlier. Maybe 1 or 2 GTs your marks may be a little less. Don't worry, these things happen. This is not going to affect your exams. Okay, so keep these things in mind. Alright. So let me take few questions. So Worthy Doc, I hope I have cleared your doubt regarding GTs. Then so Worthy Doc is again asking me that I am not revised ortho yet. What should I do? Shall I leave it? Cause I have some other subjects are also pending. Don't leave, please my dear students, don't leave any subjects. If you take the DocTutorials subscription, the one it's very cheap actually. So if you take that subscription, orthopedics has been covered in 6 hours. Quick revision program is there. The video is recorded in there. We are covering orthopedics in 6 hours. So each short subject has been covered within 6 or 8 hours. Okay, if you spend that much time, that is enough for you to get at least 70% of the questions right in orthopedics. Okay, let's say you get 10 questions in orthopedics, if you get 7 of them correct, that will go a long way for your exam. Okay, so for all these short subjects that you have not read so far, you have no time to read the whole subject. So best thing is to take a subscription like this and watch the QRP videos, or you can also join the face-to-face CPR session if you want. So never leave any subject. Okay, so best thing is to watch the QRP videos or to attend the CPR sessions for all the short subjects that you are left, because in a very short time you will be taught the most important recurrently asked questions of each of those subjects. Okay, so keep that in mind. Alright, so let me quickly focus on the group 3 students who have not finished the subject. So repeaters who have scored less than 140 in prior exams. So how many of you students feel that they are in group 3? So I can see that quite a few, okay, there are few doubts, I will come back to those later. Okay, so I think that there are quite a few students who feel that they are in group 3. Okay, so I think there are a lot of students who feel that, oh my god, I have wasted so much time, I have not finished my subjects, there is no point in doing the exam now, it is better that I take a rest, don't force myself to attend this exam, maybe I will attempt the next exam. Okay, yeah, Prince is saying that he was stuck around 130. So you are in group 3, don't worry, there is a way for you also. Okay, don't worry at all. So there are so many students who ask me, in fact I got a message even today saying that, sir, is there any point in me taking the exam? It is better that I attempt the next exam after 6 months. Even my friends are saying that there is no point, there are only 50 days left. So is this the attitude you should have? Never, never. Okay, so remember, these are the questions that I often get from the students in group 3. First question they ask me is, do you have enough time? Let me say in big letters, yes, you have enough time, enough time. The only thing you need is 150 marks and you have enough time to score 150 marks. I am sure that you do not have enough time to score 200 marks, but 200 marks is not necessary, isn't it? 10 years after you pass your FMGE exam, when the patient comes to you, the patient is not going to ask you, sir, how much mark did you get for FMGE? Whether you score 150 or 200 or 300 marks, you will be treated just the same by the patients. Okay, depends on what your attitude is towards your patient. Mark doesn't matter, only thing is you have to pass, and passing is possible. Passing is possible. Okay, you have already read at least some amount of subject in your universities, so you have a fair idea of what is going on. So just a little bit of push is what is needed, but it has to be consistent, and every day you have to spend at least 12 to 14 hours for this. Okay, I will come to that. Now the question is, if you want to do this, when to start? You tell me, when should you start? If you are in group 3, when should you start? Tomorrow, day after tomorrow? There is a game coming up after watching the test match. You should start today. Okay, so if you are in category 3, you have to start today. Today is their time. Yes, you have time. So it is almost 8 o'clock. We will finish this session in 10 minutes. From 8:30 till 10:30 you have time. Okay. So my dearest students who are in group 3, who are struggling, who find that or who think that it is not possible for you to pass, you start today. Start today. Okay. So there is a very famous book by James Clear called Atomic Habits. I think many of you would have heard about it, or at least few of you would have read it. So he says that in order to create a habit, here we are trying to create a habit of studying for 50 days. In order to start a habit, the first problem is inertia. So when you think about studying, the first thing is, oh, I will not start studying today. It is already 8. The sir is saying something. So it's boring. I'll start studying tomorrow. Probably I'll take rest. Maybe I'll go out for dinner and come back and take stress and study tomorrow. Tomorrow will never come. My dearest students, tomorrow is never going to come. Okay, tomorrow is never going to come. Tomorrow is today. Okay, so you have to start today. Today, you start studying at 8:30 till 10:30. You start whatever subject you feel like you start. Once you start studying today, tomorrow it will be much easier. Okay, if you keep on delaying your studies, it will just become worse and worse and worse. So please promise me you will start reading at least something today. Okay, from 8:30 to 10:30, or in between you take dinner. Rest of the time you start. That start itself will go a long way. Okay, very important. How long should you study? 12 to 14 hours. Okay, 12 to 14 hours. So this is something that you have to do. Okay, this is a matter of your livelihood, the happiness of your parents. So I am sure that for 50 days of your life you can spare 12 to 14 hours. That is all. Even after 14 hours, you have 10 hours to enjoy, sleep, take rest, take breaks in between. Okay, so remember, learn, you read for 12 to 14 hours for the next 50 days. I am sure that you will be able to pass. I am not sure if you can score 175 or 200, but I am sure that you will be able to score above 150. Okay. So what are the strategies you have to follow for a group 3 student? Okay. So here earlier I told my category 2 students to revise everything. Okay, and you revise according to the schedule, but for you guys it may not be possible to read the whole subject. Okay, so you focus on the top 4: medicine, surgery, OBG and PSM. You have to study the subject. You can keep aside 15 or 16 days, 4 days for each subject, that is okay, but you have to be thorough with these 4 subjects. Okay, medicine, surgery, OBG and PSM. And if you can, if you have time, you add pathology to the mix as well. Patho will also give you sometimes 15 to 20 additional questions. Then for the others, you watch the QRP videos or you attend our CPR sessions. CPR sessions is again the advantage of CPR session over QRP videos is that QRP is recorded. Sometimes there are so many students who feel or who start watching QRP videos and finally are not motivated enough or get distracted in between, do something else, come back and watch half an hour again, then go back, do something else, come back and watch again. But if it is CPR online session, the faculty is right there in front of you, the chance of distraction is less, and if you have any doubt to be cleared, you can also clear it there. So depending upon what you want, you can either watch the QRPs or do the CPR sessions. Then you do the PYQ of previous 10 papers. So this is non-negotiable. Okay, so this is non-negotiable for you guys. You have to learn the previous 10-year PYQs and you have to read previous 3-year PYQ of 3-year papers is enough, not 3 years, 3-year PYQs of INICT and NEET PG. Okay, this you have to read. There, I am sure that if you read this much itself, you get at least 50 questions from this. There will be multiple repeats. Maybe the options would be a little bit here or there, otherwise it will be the same. Okay, so you have to also do 100 MCQs per day and also attempt GTs weekly. That the same things that I told for group 2 students also you have to follow. The only difference is that you will not have enough time to cover all the 19 subjects. You focus on the top 4 plus pathology if you have time, and watch the QRPs of the other subjects, and you focus on doing PYQs, MCQs and GTs. Okay, this is what you can do. Now I think there are few questions. Let me see if I can. So Prince is saying that you are stuck in 130s. Don't worry, you follow this. I am sure that your score will be above 150 today. Start. When will you start, Prince? Start today. Okay, start today. The next question is, sir, in custom module I reached 70 to 80%, but in GT I am stuck in 120 and 130. Amir, don't worry, keep giving GTs. I am not sure if you are going back to the GTs and assessing your answers. So this is one mistake that many students make. You give GTs, so out of 300 you get 120 correct. You have made 180 mistakes. Are you going back and making sure you are reading those topics and you are correcting those mistakes? I am sure that many of the questions from one GT or many of the topics in one GT would be repeated in the subsequent GTs as well, unless you are making those corrections. So you are getting 120 for GT. What about the 180 questions you are not getting correct? You focus on those. 120 correct answers are not a important point when you are preparing. When you are preparing, what is important is what the questions that you have gone wrong. Okay, you focus on the 180 questions that you have gone wrong from today, please. Okay, from today, you, after giving GT, that day itself go through all the errors that you have made, take down all the mistakes that you have made in a book, and you read it for at least 2 or 3 hours. Initially, when you start doing your GTs, when you are doing this correction, no, it is going to take 3 to 4 hours. Next GT, it is going to take 3 hours. Next GT, when you do this correction, you feel that, you will see that the amount of time you take to correct your mistakes is just 2 hours. Okay, so this will keep on decreasing and your number of correct answers will keep on increasing. Okay. Ashik, what was your question, Ashik? Ashik is asking regarding custom module. You are asking regarding this, our CPR program. Okay. So SRM PM is asking, hello sir, I belong to group 3, I am subscribed to DocTutorials app. Is it okay to watch the V5 videos or the entire V5 videos? Dear SRM, you will not get time. You will not get time to watch all the videos. Okay, unfortunately, there is no time for that. You watch the QRP videos. Okay, QRP videos. That is the only time we have. Okay, and you keep on doing PYQs and MCQs and attempting GTs. Okay. All right. So what are the things to be kept in mind for all of you? Okay, all of my dear students, whether you are in group 1, group 2 or group 3. So what are the points that you have to keep in mind? First and foremost, you have to plan well. Okay, there are only 50 days and you have to prioritize and you have to keep all the important points in mind. So you make a timetable which is best suited for you. Then make sure you follow that plan. Just making a plan is not great, isn't it? You have to follow the plan. Then you have to reduce your distractions. So if you are addicted to Instagram or WhatsApp or Facebook, please you log out of all those things. Okay, you don't have to use any of these social medias for at least 50-60 days. Then you have light healthy food every day, you sleep well, then every day you do at least 30 minutes of exercise. This is very important because you don't have to go to the gym or anything. In your house itself, you do light walking or light exercises. This will release endorphins in your body. These are happy hormones. So this will help you to settle your stresses and it will also improve your memory. So retention would be greater. So you can do that. One important point is that don't compare yourselves to anyone else. Okay, each of you students listening to me are different from each other. So you don't have to compare yourself to anyone. Some other people would be studying in a different pace than you. It doesn't matter. Maybe someone else is faster than you. Someone else is slower in studies than you. It doesn't matter. It is not a competitive exam. You don't have to score more marks than your friend. Only thing is that you have to score more than 150, isn't it? But it is very good to compare with self. That is, if you are giving a GT, today you score 120, make sure you work on it and next time you score 130. The next time you compare it with yourself and make sure you improve the score on each subsequent GTs. Okay, so keep on doing that, keep on reducing your mistakes, and you avoid contact with demotivators. Okay, so there will be many of your friends who would call you and tell that anyway we have not studied anything, what is the point in studying now, just 50 days more, let's enjoy, let's go for a movie and come back, why to take this stress, there is another exam coming after 6 months. Don't do that. Okay, focus on your goal. Your goal is to get 150 marks. Okay, 150 marks for your exam. So avoid contact with demotivators and you focus on yourself. Very, very important. Okay. So Dr. Kerala is asking, I am stuck at 100. What is the need? What should I do to increase the score by 50? Okay, understood. So you come in category 3, you are in group 3, so these are the things that you have to follow. Okay, you don't have enough time to read the entire 19 subjects, you have to focus on the important ones, medicine, surgery, OBG and PSM first. Then you have to, if you have time, also do the pathology ones. Then you focus on the QRPs of the minor subjects, you do the PYQs of the previous 10 papers. You do 3 PYQs of INICT and NEET PG papers, do 100 MCQs a day and attempt GTs. Okay. Okay. So my PPT is finished. If you have any specific doubts, you can ask me. Okay, Ashik Hussain, I am just seeing your question now. Okay, is custom module important to do daily, and till which date should we do custom module, and in last month what to do? In last month and sir, in custom module 25 questions out of 50 MCQs. Okay, you can do custom modules for another 20 days or so, it is okay, you can customize it, no problem. But after that I would say you do more GTs. Okay, 25 out of 50 questions is okay. As I said, you assess where you are making the mistakes and you try and improve it. Okay, all right. So if you have any more doubts or if you have any more aspects you want to clear, you can ask me now. So I have one question, sir, only question from group 1, which MCQs to do, should we do subject wise? Amir, if you are in group 1, you can do in whichever way you feel correct. Okay, because you have already done the hard work, there is this is the final lab, so you can do it in a subject wise manner, no problem. But towards the end, towards the last 15 or 20 days, I would suggest you do more GTs, except in the last week before your exam. Okay, when you do GTs, you get a holistic picture of how things would be and how the exams would be conducted. Okay. Can also prepare own notes this time for QRP and or PDF is enough. So Amit Singh, I am not sure if you will have enough time to prepare notes now. Okay, so if you, it's better to use the existing PDF, and if you have any additional points to add, you can just add it on the PDF itself. I don't think you can afford the time to start everything once again. Okay, you don't have enough time to prepare notes now. If you have any notes that you have already prepared, you can obviously go through it. No time for new notes. Okay. Ashik is asking what tag should we use in custom module. I will get back to you regarding that. Okay. Amir is asking 7 to 8 GTs till exam. Yeah, you can, Amir, you can do 7 to 8 GTs till the exam, but I will not suggest you do an exam GT right before the exam. Okay, because if there is a little bit lower mark for that GT, it can demotivate you. So I don't want that to happen. So before 5th or 6th of January, you complete your GTs. Okay. All right then. Great. I think it was a very interesting session. So I think we can wind up today. All right. So I just want to tell you that there are all of you are brilliant students, and only thing missing is that last bit of effort. If you put that last bit of effort, it is very easy to score above 150 marks. Okay. So don't worry at all, be confident, go to your exam with full confidence. Okay, don't panic, don't stress, there is enough time, put in all your effort, that is all that is required. All right. So I think it was a great session. So thanks for all the students for being so much interactive. So if you have any doubts as well, you can actually contact me. So I'll just write down my WhatsApp number here. So if you have any personal doubts or any guidance that you want regarding this, you can actually message me or WhatsApp me in this number. I'll be more than happy to help you out. Okay. Okay, Amir is asking only subject remained is anatomy, what to do for that. I think you have enough time to read anatomy. You can take 3 or 4 days for that. No worries. Then you can start your revisions. No, FMGE is not a must for PLAB or USMLE. Okay, there you have to write another. I mean, those are other exams for other countries. For practicing in India alone, FMGE is required. Okay, so I think it was a great session. So again, you can just look at this number. If you have any doubts, you can message me to this number. So all the best for your upcoming exam, and don't worry at all, put in your effort, and we'll all be praying for you. All the very best. Good night.